He is in pyothorax, which means there is probably had something penetrating, and so we're going to put a drain in so we can pull out all the infected fluid for the next couple days. Yeah, like that, but
So our little poor kitty friend was hit by a car, and it looks like we have a fracture on this femur, on the head of the femur, and part of the head of the femur is still there attached, but it looks like it was fractured right at that point there. So there's some still stuck in the socket there. So what we're going to do is we're going to just open the wound and cut off the head of the femur right there, and then sew it back closed to the point where the muscle layers will make a false joint there and hold that leg in place, and he'll use that to walk.
Hi, I'm Jeff Runge. I'm one of the attending surgeons at Guardian Veterinary Specialists. I wanted to talk to you about a case that we just finished surgery on. It's a cat named Schnitzel. This patient had unfortunately sustained a hit by car injury about a day and a half ago. And this particular cat unfortunately had trauma to his chest, its abdomen, and its pelvis. What we were able to diagnose was a very unique kind of condition that showed there was a tear in the diaphragm, which means basically there's a hole that communicates between the abdomen and the chest. When the cat was hit by this car, it caused such a gigantic impact of pressure that it actually created a tear through the muscles of the diaphragm. In this particular situation, the kidney, specifically the right kidney, was actually herniated through the diaphragm and was stuck. Now, Schnitzel unfortunately also sustained a right femoral head fracture. So we were planning on doing two separate procedures, and we wanted to start with basically the abdominal procedure, fixing the hernia first. So in surgery, what we actually did is we approached the abdomen and we carefully found where the herniated kidney was and slowly pulled it back from the chest cavity into the abdominal cavity. We then repaired the tear in the diaphragm using a special kind of suture that allows us to have it heal properly. Once we had that finished, we went ahead and made sure there's no other abnormalities in the abdomen, and then we closed up the abdomen itself. We then moved on to the orthopedic procedure, fixing the right hip. Since this fracture consisted of the femoral head being damaged, we actually removed the femoral head and did something called a femoral head and neck ostectomy, which is going to allow Schnitzel to have excellent range of motion in the right hind limb. So right now, Schnitzel is going to be finishing surgery momentarily, and we're going to go ahead and start our recovery process and should be going home in about a day or so.